What is TRUS? A transrectal ultrasound, or TRUS procedure, is an ultrasound technique that is used to view a man's prostate and its surrounding tissues, allowing the physician to check for abnormalities. It is done to examine an enlarged prostate, diagnose prostate cancer, help guide the doctor when taking biopsy samples of the prostate, or to help identify the cause of infertility in a man. Preparing for the procedure. A TRUS is usually done as an outpatient procedure and typically takes 5 to 10 minutes to perform. The ultrasound exam is performed under local or general anesthesia to minimize any discomfort. Like most procedures, do not eat or drink anything past midnight the night before your ultrasound in order to avoid complications. You should also avoid taking aspirin or other medications that may thin your blood 7 to 10 days prior to your ultrasound if a biopsy is being considered. If your surgeon recommends, you will need an enema 1 to 4 hours before the procedure to help clean out the colon, and you will also need to empty your bladder. Procedure. Once you are positioned, you will be laying down on your side on the table. Your physician will insert a lubricated ultrasound transducer or probe into your rectum. The transducer will direct high-frequency sound waves at the prostate, which will help generate a three-dimensional image of the prostate. A TRUS allows your physician to take measurements of the size of the prostate, which can be used in the treatment of voiding problems. In the presence of an abnormal prostate-specific antigen, or PSA, a prostate biopsy is usually performed. To perform the biopsy, a small needle is projected through the tip of the probe and through the rectum into the prostate. The biopsy needle is used to extract tissue samples from the prostate. Your physician will take several samples from different areas of the prostate to examine any abnormalities or determine the presence of cancer. Side effects and risks. After surgery, you will spend some time in recovery. If you were sedated, you will need to have someone pick you up, so be sure to arrange transportation. Do not operate heavy machinery for 24 hours. Side effects are short-term and may include bleeding from the rectum or urethra for a few days after a prostate biopsy. The biopsy sites may be tender or sore for a few days as well. You may notice bright red or dark brown blood in your urine or semen for a few weeks, which is normal. Drink plenty of water to help reduce the bleeding. In rare cases, a man may have difficulty urinating after a prostate biopsy because of swelling of the prostate. This side effect is usually temporary. There's a 1 to 4% chance of getting an infection during a biopsy. Antibiotics will be given to minimize the chances of infection. If you develop a fever of 101 degrees or greater, call your physician immediately, as this is a sign of infection. Follow-up. Follow-up examinations may be necessary, and your physician will explain the exact reason why another exam is required. A follow-up exam may be needed because of a suspicious or questionable finding that needs clarification by getting additional views of the prostate or taking more tissue samples. A follow-up exam may also be necessary so that any change in a known abnormality can be monitored over time. Even if your results come back negative, a follow-up exam is still important and the best way to monitor your health. Thank you for taking the time to view our video. We hope that you are better informed about your upcoming procedure. Your nurse or physician will be with you shortly to answer any further questions that you might have.